What role do advocacy groups play in epilepsy driving laws? Imagine trying to balance safety on the road with the freedom to live independently. Advocacy groups are key players in shaping how laws around driving and epilepsy are made. They work to ensure laws protect everyone while respecting the rights of people with epilepsy. These groups, like the Epilepsy Foundation and the American Epilepsy Society, develop guidelines that help create fair rules. For example, in the early 1990s, they helped establish principles like setting a minimum seizure-free period, often 3 months, before someone can drive again. They also promote that licensing decisions should be based on each person's seizure history and risk, not just rigid rules. This approach helps tailor restrictions to individual needs, reducing unnecessary limitations. Advocacy groups also advise policymakers and government agencies. They act as expert voices, translating complex medical information into practical driving regulations. Their goal is to ensure that laws are based on current scientific understanding and that they are applied fairly across different cases. They emphasize that decisions about who can drive should involve medical advisory boards, not just individual doctors, to keep things consistent and transparent. A big part of their work is promoting personalized risk assessments. Instead of blanket restrictions, they encourage evaluating each person's seizure control, frequency, and overall health. This helps find a balance where safety is maintained without unfairly limiting someone's independence. They understand that driving restrictions can affect mental health, social life, and even employment, so they advocate for laws that protect public safety while also supporting alternative transportation options for those who cannot drive. Education is another vital role. Advocacy groups provide clear, accessible information to patients, families, and healthcare providers. They help people understand their rights, the reasons behind restrictions, and how to follow legal requirements. This knowledge empowers individuals to make informed choices and stay safe. They also address the tricky legal and ethical issues around reporting seizures to authorities. Some laws requiring healthcare providers to report patients who might be unsafe to drive. Advocacy groups suggest that reporting should be allowed but not mandatory, to avoid discouraging people from seeking medical help or being honest about their condition. They highlight that mandatory reporting can sometimes lead to underreporting and unsafe driving if people hide their seizures. Beyond driving laws, these groups work to protect the rights of people with epilepsy through laws like the Americans with Disabilities Act. They aim to improve access to healthcare and seizure management, which indirectly supports safer driving. Their efforts help create a balanced system that values safety but also respects individual rights and quality of life. In essence, advocacy groups are the bridge between medical science, legal policy, and personal safety. They help craft laws that are fair, evidence-based, and flexible enough to consider each person's unique situation. Their work ensures that safety on the roads goes hand in hand with the freedom to live independently, making sure everyone gets the support they need to stay safe and empowered. Always remember, if you have epilepsy and are concerned about driving, consult your healthcare provider for personalized advice and guidance.